Joining us right now is a friend of the show. I absolutely love her. She's the reason why I got vaccinated, y'all, because I was like, I ain't trying to do this Tuskegee. And she was like, girl, stop. Go get that vaccine. And I appreciate her because I feel so much safer. And I'm about to get boosted with this new variant booster because of Dr. Christy Pernell, who literally was in the Moderna trial and is still here looking beautiful and smiling. Although I think we're going to have a very difficult conversation today, but I'm grateful that she's here. Dr. Caretha Mitchell's here. Let me welcome back to the show, Dr. Christy Pernell. Thank you for being here.
Thank you. Thank you. Thank you. It's always good to be on with you, my sister. And I'm very happy that you got vaccinated. And I'm very, very happy to hear that you are soon to get your bivalent booster. So anyone listening who is not boosted, please, 12 and above, and it's been at least 2 months since your primary series or a booster, you should go out and get boosted.
Now, this before we get into the story, bivalent, is that what you call it? Bivalent?
Yes,
bivalent.
It has coverage against the original strain of coronavirus, as well as the current circulating variants, or at least the current circulating variants that we knew of when it was formulated. There will always be the opportunity that newer variants would emerge, but there is coverage against like the BA4, the BA5. So that's why people should go get it.
And when you say coverage, it doesn't mean you can't get it.
No, it doesn't mean you can't get it. Remember, vaccines are to prevent severe illness. Vaccines do not totally eliminate the risk that you will get infected. Vaccines, let's say, seriously reduce the chance that you will get severe disease. So that's why vaccines are proven prevention tools.
Now, with this particular one, it's not like, the mumps or the measles or chicken pox, rubella and all of the vaccines we got, because this virus, this new coronavirus, novel coronavirus, keeps mutating. Mm-hmm. And so for people who like, I'm on my 5th booster, damn it.
Well, think about it this way, right? I know we're talking about prevention, but if you have a condition, like any health condition, you must do routine maintenance of that health condition. Sometimes you must take medicine on a daily basis, or sometimes you have to take screening exams more frequently or testing procedures more frequently. This is our way to ensure that we are being vigilant, always prepared, and staying ahead of the virus. And the virus is going to change because it wants to out-survive us. It wants to out-compete us. So the more evidence that we have that the virus is mutating, the more we're able to go back into the lab and say, hey, do our currently available vaccines hold up? And the ones that we had available, the boosters that we had available, were not as strong or competitive against the strains that were circulating. So that's why we changed it.
And the mRNA, I'm sorry, Dr. Mitchell, the mRNA technology.
Yes, allows you to do that very quickly.
That was Kizzmekia Corbett was involved in producing for Moderna in particular, right?
Yes.
Allows them to tweak it. Because, and so when people's like, oh, where did they come with this? Well, this technology has been around for at least a decade.
Decades, yes. It's a genetic recipe. That's how I want people to understand it. Think about a recipe when you're cooking a meal, and that you can go back into that recipe. You have the blueprint, you have the instructions. And because it's a genetic recipe and we have that blueprint, it can be tweaked, as you say. It can be changed slightly so that it provides coverage against any changes in the sequence of the new variants.
Now, Dr. Christy Pernell, you were in the original Moderna trial, which helped me a lot because I'm like, I know you, so I know you're not out there being reckless with your own health. And you didn't know whether you were in the sample, the placebo trial or the ones that were actually getting the actual vaccine, but you found out later that I think you did get the actual vaccine.
Yes, I did.
Was there a trial for the boosters as well? Do you continue in the trial? What does it mean to be in this trial? Is it, permanent? Are you always in it?
I'm done. Actually, okay. I just graduated, if you will. I had my last appointment about a month ago. So they follow you for 2 years, a little bit over 2 years. And I had reached the 2-year mark to see if there were any adverse reactions, any unknown consequences from being vaccinated and across following myself and millions of others across the study, right? There have not been any unforeseen outcomes that would say these tools are not safe. And remember, based on vaccine science, decades and decades and decades worth of vaccine science, if there's going to be a serious or unwanted side effect, that is most likely going to evidence in the first 6 to 8 weeks after administration. So when we have 2 years worth of information, we have a lot of, let's say, a lot of genetic data, a lot of real world data, a lot of scientific data to say people are able to safely be inoculated or vaccinated with these tools and provide the best available coverage that there is.
Let me just thank you for putting your body on the line for us because you did that. And as a Black woman, you know, for Black people, to be part of a scientific experiment, basically, to see if something works is not something most of us would sign up for.
Yes,
so that you did. Yes. What did you learn? Any regrets? Anything that you would have done differently being a part of this trial?
First of all, no regrets whatsoever. So everyone knows I am a public health and preventive medicine physician. So I believe in the science. And when I say I believe in the science, I've studied it. I've had to study it, and I've had to be able to comprehend and translate that scientific knowledge into real world understanding. And I have seen the proof of vaccines through decades worth of research and outcomes. And I know that clinical research can be a powerful tool to save and prolong lives. My father was a living testimony of that. My father had chronic HIV/AIDS. And because of the advances in HIV medicines, he was able to live with an undetectable viral load for well over a decade. And that had not been true when the AIDS epidemic first broke out in the United States. We didn't have the tools that we have. The problem for our community, the Black and African American community, is that we have been abused by science. We have been abused because of white supremacy. And that's why I felt it was so necessary for me, a Black woman, a Black public health physician, a Black woman who lost her father, whose sister was a long COVID survivor, who had also lost 2 cousins, to step forward and to be able to demonstrate with confidence for my community, first and foremost, that this was a measurable advancement in science and technology, and one that we needed to be able to take advantage of because we were dying disproportionately. And we were a part of the discovery. Our intelligence, our intellectual capital helped to solve the scientific and infectious disease conundrums. So I also wanted to uplift that and say, look, we're a part of this process. We're not absent from it, and we are safeguarding and ensuring with accountability that things are being done in the most ethical, fair, and just way. So no regrets. No regrets.
Thank you. Thank you again. Dr. Christy Pernell. She also wrote a book called Letters to My People, Inspirational Essays, Poems, and Affirmations, which we gave out at Healthy, Wealthy, Wise. The last time I saw you, no one got sick at our conference. We were very, even though folk in Pennsylvania are wild, not as wild as Florida, but pretty wild in Pennsylvania. And I felt really good about that because we use best practices, and I consulted with you about that as well. So I just want to thank you. Dr. Caretha Mitchell is here as well. I'm sure she has questions. I don't want to hog you up all hour, because I will.
Yeah, I just have to say, first of all, just thank you for your work. I am absolutely honored to be talking to you. And I have to say that it's watching Black women physicians like yourself that made me so confident about the vaccines. The fact that the science moved the way that it did had everything to do with how miraculous the level of science was. And it was clear to me from the very beginning, but I also was talking to Black women doctors who were operating in exactly the spirit you are, and in fact, confiding in me about the ways that they felt like they weren't being heard in terms of their family, friends, recognizing, no, I am in this with you. I definitely was one of those people who was very happy to get the vaccine. I actually ended up getting a booster before I was supposed to, and then I got another booster with the latest one, because at the end of the day, what has been striking to me and why I'm so grateful for Black women physicians like you is that Americans, by and large, didn't do the bare minimum in terms of basic things to protect each other, right? The following of CDC guidelines was something that people protested. So I don't know what makes people think that the CDC can give rules as if they're giving them to people who would even comply. They can't pretend that Americans are more compliant than they are. So because I'm watching my fellow Americans not have much regard for each other, it makes sense that the virus is having such a good time partying and reproducing. So to have people like you doing that science is exactly why I am just so grateful to be able to have access to these vaccines.
Thank you, thank you, thank you so much. You know, I think it's a very important point for us to drill down on that you said, wow, we in the United States, we lack collectivism, right? That this sense of community, that we are all in this together. And public health is mandated on keeping a mass group, a population whole, healthy, and well. So the behaviors or the actions of one definitely does impact and affect the outcomes of another. And so because we are so drunk off of the wine, if you will, of this American exceptionalism, right? This rugged individualism, right, that is rooted in imperialistic and supremacist thought, truthfully. We were slow to believe the science as a nation, and we fought and became anti-science in a way that I had not seen in recent years. And I believe that was fomented by political actors. I believe that was fomented by the level of disinformation and misinformation that was willfully put into the social media space, our public spaces. And the last thing that I want to say, though, if you look across different ethnic groups, you saw different abilities or willingness, if you will, to accept and adhere to certain of the infectious prevention guidelines. For instance, Black and Latino people were more adherent to mask wearing than were others, and probably more enduring in that behavior than we saw in other populations. Where we had any sense of a wait and see approach around vaccines is because of our history. We actually are very rational actors. Where you showed us the science worked in mask wearing to prevent, we were more likely to do that. And where we had proof and we had data and we had a fact pattern to say that we have not always been in a position to trust medical institutions or science because of the abuses, you saw a deliberate, slow investigation, a deliberate, slow, reviewing of the data. And that's what I wanted to help our community be able to do. And I wanted to be able to hasten that process just because I knew how unprecedented the crisis was and how potentially severe and deadly this virus was.
Considering your passion, Dr. Christy Pernell, it is stunning that you are finding yourself in the crosshairs of being diminished, right? Yes. When your sole goal, your goal as a doctor is first do no harm, but also to serve people, which is what you do so passionately. Last time when you were at Healthy, Wealthy, Wise, you had to run off to do something for the hospital that you work for. Yeah. You had an event, and I was like, all right, I'm sorry, you're gonna miss this space night, but you had to go do that, and now they've ousted you. Yes. Back to back, 2 days in a row. I'm talking to powerhouse people who have been, created spaces for folk, and the power system has felt threatened. What were they threatened by you? I don't understand.
Definitely threatened. Since I was forced out of University Hospital, my last day was on September 2nd, 2022. I have had an outpouring of physicians, in particular, Black physicians, Black corporate executives, women generally, and people throughout the field of medicine and public health stand up and say, what happened to you, unfortunately, is a part of a pattern of abuse. It is an abusive relationship between white power structures and Black executives, especially within healthcare. And I can tell you that too often that people like me, first of all, we're of the 3%, right? And I want people to understand that 3% of active physicians in the United States are Black women. 3%. If you then look at those who are leading in healthcare institutions, we don't have a firm piece of data, but it is substantially fewer than the 3% who are active physicians. And because we are so few, the barriers, the obstacles, the inequities, and the power structures that are arrayed against us are armed heavily to eliminate us if it is perceived that we get out of line, if it is perceived that we threaten the vitality of the status quo, if it is perceived that too many others are, let's say, paying attention to what we're saying. And I experienced that at University Hospital. You know, I never came on here and represented my hospital or my role at the hospital because I had firm guidelines that said, we want you to create a separate lane. We want there to be separation, because I had a board chair who was furious with the media attention that I was getting. And I had anonymous letters circulated about me that said I was mouthing off. You say, hey, you're helping to save your community. And here I had people saying I was mouthing off. Here I had people saying that I was not keeping my eye on the ball. Here I had people saying that everybody isn't a Democrat. And even some of the Democrats, we don't like what you're saying, because I was critical of Donald Trump. So I was a Black woman who was firmly grounded in my professional practice, but also speaking truth to power. And when you speak truth to power, Karen, you know, you have an expiration date at times when that power doesn't want to share power or relinquish its power. So I definitely felt a mixture of, I was welcomed in by Dr. Elmer Hall. He's now the Undersecretary for the Veterans Administration. Biden nominated him back in March of 2020. I was welcomed in by him almost 3 years ago. Very excited about the role. My role was not a typical diversity and inclusion role. I didn't want that. I didn't want a symbolic role. I didn't want a performative role. My role had operational oversight. My role was designed to have impact. And so what I soon learned, I was called aggressive probably within 2 weeks of being on the hospital grounds by another white woman executive. I was dismissed from a hospital meeting by another white woman executive who said that this business wasn't relevant to me. I was once told, oh, Chris, you should carry our water. And then that same person, when I checked her with my eyes, came running to my office to apologize. There were barriers around hiring qualified staff for the restructured and the redesigned departments that I oversaw. There were barriers around compensation. I believe firmly in pay equity and wanted to ensure that the people who had the credentials, the expertise, and the work history to do the work, especially around equity and inclusion, around population health, and around the patient and human experience, were appropriately compensated. So often that set up operational battles between myself and other executives in the C-suite. And I frequently would have to tell my CEO, or frequently would have to advocate and say, I'm being treated like a second-tier chief. My ideas are scrutinized. I'm given different hurdles that I have to jump over that I knew others did not. I remember calling one of the chiefs into my office, and I found that this person was always hypercritical of what I was saying. And I was the one who had the expertise in public health and population health, but yet this older white man always questioned me. And I told him one day, I leaned into him into my office and I said, what gives? You're going to have to tell me. What gives? Where does this scrutiny come from? And he got really, embarrassed and ashamed. And, that relationship started to thaw, but it was the ability for me to advocate. It was the ability for me to assert my role in my professional expertise that first ruffled feathers. And so I was put through a compliance investigation around my media appearances. And it was told that, what was alleged, it was sent to the governor's office. It was sent to the mayor of Newark. It was sent to elected officials. She doesn't have permission to do this. And I had permission to do it because then the hospital wanted to curtail the use of their name. And so I always had permission to appear in the press. And then I had guidance around how the hospital would be okay with me appearing. So I survived that first compliance investigation, which lasted for 2 years. No one else in the C-suite went through an investigation of such. I survived that investigation, but I believe it gave people a playbook. And so when my CEO was nominated and when he ultimately left the hospital in May, and when public support was so large and so organic around supporting an application for me to apply, that's when the retaliation and the targeting as me as a Black woman executive at the hospital spiked through the roof. And that's where I was investigated again. And it was told that I used my state role or my state title inappropriately to pressure staff to support me. You all know that's a lie. Wow. You all know that's a lie. And so within, I was notified of that investigation on July 25th. And I was actually ambushed. I went to the interim chief legal officer and I said, hey, what's this email that I need to sit down with this outside law firm? What is this about? And everybody was mum. Nobody wanted to tell me anything. So I walked into a room with outside lawyers, sat down, and the first thing the lawyer says to me is that usually staff have a counsel when we interview them. And I said, how would I even know that I should have counsel when I haven't been told what this is about? So that was the nature of the investigation. It was hostile and it was directly in retaliation because so many public and community stakeholders, former governors, sitting congresspeople, mayors, elected council persons, community stakeholders, CEOs of organizations, deans of colleges, wrote and supported on behalf of me becoming the next CEO. And I began to sound the alarm when that happened. And from July 25th until August 9th is when I told what my last day would be, September 2nd.